We opened our hospital in 2016 on the 18th of January, and we moved from our existing facility at Fig Tree, which is 100 beds. It was a great opportunity to be involved in a project like this. Wollongong in the past hasn't really had that state-of-the-art facility like we have now, and a lot of patients still unfortunately go up to Sydney for their healthcare services, and we've really turned that around since we've been open, and we hope to turn that around even further into the future. That's the plan.
Working in intensive care before working in this role, we did a lot of transports to CTs and things like that. So there was quite a lot of equipment to take before you even, took your bedside monitor with you.
Often we had to transfer the patient from their normal bedside monitor to a transport monitor. So that meant that what we had to do was actually remove them from the monitor they were already on and then transfer them to a different monitor.
We wanted an integrated solution across the hospital. Mindray's certainly done that, and have been great at providing that integration across the whole hospital.
To me, the T1 is the heart of the system.
The T1 makes transporting patients a lot easier because we can simply clip the transport module out from the bedside monitor and take it with us.
You pull the transport module out and just simply plug it into ICU.
If there's any deterioration in that patient, we can see straight away, so it enables us to act quickly.
The patient's data is carried with them throughout the hospital and also saves us time from transferring them to a different monitor. The T1 also communicates to a central monitor that we have at the nurses' station, and that makes it really easy for us because we can actually monitor the patient from the nurse's desk, and it means that we don't have to disturb them if they're resting or if they have visitors.
It's all connected. It's connected to a printer as well, so we can print off the information from the operating theatre, put those in the patient's notes as well. So just the whole system is excellent.
It also lets us locate old data from patients, so patients that have been discharged. If any of our consultants were wishing to get that data or wanted to look for any arrhythmias for some of their patients that had already gone home, we're able to pull that data from discharged patients.
As far as the anaesthetic machines go, they're user-friendly, so we can move from the information in the anaesthetic machine can be then moved to the recovery unit, so we've got a consistency of observations on that patient throughout the operation as well as their recovery period.
The support from Mindray is great. They're a phone call away, and given the technology is so simple to use, a lot of the issues can be sorted out over the phone. They're a lot more hands-on, they're a lot more, at the other end of the phone, whereas a lot of the bigger companies, it can be a lot of hard work getting through to talk to someone that can actually help you with your problem.
Mindray were very accommodating with helping us to assist to achieve training, and they didn't leave until all the staff were trained, so that sort of commitment is a little bit unheard of from some of the big companies. The staff all rave about the product. They're all very happy with it.
The team have responded really well. They're really enjoying working with the equipment. Because it's so easy to use, it really is.
Working with Mindray has been easy. I've used a lot of different systems, I've worked through a lot of different hospitals, and this is definitely the most user-friendly.
The products speak for itself, the equipment's great, but to have that support is key to the success and ongoing success of the relationship, I think.